Have you ever looked in the mirror and wondered, can gums that have receded from gingivitis actually grow back? It's a question I get asked a lot, and while the classic answer is usually no, today I want to dig deeper. Let's explore the latest science, some exciting theories, and a dash of nutritional wisdom. First, what actually happens during gum recession? Gingivitis, that early stage of gum disease, causes inflammation. If left unchecked, your gums can pull away from your teeth, exposing roots and making your smile look, well, a little less smiley. Traditionally, dental experts say once the gum tissue is gone, it's gone for good. But science never stops searching, right? Here's where it gets interesting. Recent studies are looking at growth factors, proteins that signal cells to repair and rebuild. There's some buzz about using platelet-rich plasma, or PRP, to encourage gum tissue regeneration. It's still early days, but in theory, if you inject these growth factors into the gums, they might help your body regrow some of what's lost. What about stem cells? This is where things get super futuristic. Scientists have managed to regrow gum-like tissue in the lab using stem cells from the patient's own mouth. The hope is, one day, we could use your own cells to patch up damaged gums. It's not available at your local dentist's office yet, but the groundwork is being laid. Now let's talk about nutrition, because your gums are living tissue, just like the rest of your body. Some research suggests that vitamin C, omega-3 fatty acids, and antioxidants can support gum health and reduce inflammation. Foods like dark leafy greens, fatty fish, and even nopal and pinole, yes, the ancient superfoods, may help keep your gums as healthy as possible. But what about implants or miracle cures? Dental implants can replace lost teeth, but they don't regrow gums. And while you'll see miracle claims online, beware. There's no magic gel or oil proven to regrow gum tissue overnight. The real miracle might be a blend of science, good nutrition, and a little bit of patience. So is it theoretically possible to regrow reduced gums? Science is getting closer, with growth factors and stem cell therapy on the horizon. Nutrition and oral care matter, but for now, prevention is still the best medicine. Remember, don't take this as medical advice. Your situation is unique, and any treatment should be tailored by a professional. Think of this as just one piece of the mosaic of knowledge. 60 Sec University 174 was provided by lepreuve.com, your source of nopal and pinole. Stay curious and take care of your smile.